and our new enforcement powers are there to help us do, so that we can actually take that sort of action. So you should see change in that respect.
Can I ask a very good question on that then? So if we think that there are going to be a number of services which could be deregistered, are we going to have enough provision in our care homes for the number of people that need to be in care homes? Yeah, the numbers that you talk about in here are kind of 350. They're inadequate. It's quite a large number of homes. Do we have the provision in the system to be able to cater to the number of people we need to be catering?
I think that's what we recognise as a huge challenge, and why, I mean, part of our process is around trying to alert the council and CCG and partners as soon as we are in a position where we think that we may have a home that could be inadequate, so that planning process can happen in partnership. And it's something that we obviously want to do, but that's absolutely part of our. We're expected to do that. We should be doing that, so we should communicate with Southwark around that.
Okay, sorry, David, I interrupted. Do you have any other questions?
No, just those two.
Those two. Jasmine?
Okay, I've got questions for Helen. Sorry, I've forgotten your name. Is it Joan?
Joan, yes.
Joan, thank you. Okay, I'll kick off with Helen. I mean, I did want to say that CQC has fallen foul of its own regulation a few years ago, and I think that the appointment of David Bean and Andrea Sutcliffe has really changed everyone's perception of CQC, and I'm a big fan of Andrea's. I was interested in how you actually measure kindness and compassion. So if you could say a little bit about that, because obviously that's like a massive thing. I mean, I must have said this too often, but my experience of looking at that was Alan Johnson saying that he wanted to measure how many times a nurse smiled when he was at the helm in health, but it just shows you how difficult it is to measure. So that. The other thing is, last time I saw Andrea Sutcliffe, she'd just taken that position as chief inspector, and she had mentioned, when all the journalists were at your door asking about what she was going to do, one of the things she said was about surveillance cameras. So I just wondered what the CQC position is on using surveillance cameras around people's care. And that's enough for you. Shall I just ask Jones now? Or?
No, let's see
right,
how best, then I'll come back to Jasmine.
Okay. In terms of measuring kindness and compassion, again, we've got obviously our key lines of inquiry. A lot of where we look at kindness and compassion is under our caring and responsive part of our, but when it comes into everything really, and one of the things that our inspectors use is something called a short observational framework. So they'll go in and they'll actually observe care, and it's essentially sort of a framework of observation. So people they'll observe an interaction, and they will note down details of what happens in that interaction. And that's one of the ways that we measure. So it's through kind of observation, and they're trained to do that observation. So that's one of the ways. The other really obvious way is that we talk to people and we talk to their relatives and their family. But where we use our observational framework is particularly useful where we have people that might not be so verbal or might not be able to tell us in quite the same way, and might not have the relatives around that can do so. So that's that. The surveillance cameras, I might have to come back to you on, because we've quite recently publicised kind of what our approach is, and I can't remember all the details of it.
Are you for it then? Are you? Because I mean that's a massive thing for a regulatory body to say it's okay. Because some of the things that we've seen, on YouTube and everything, of people filming the care of the, I mean, it's pretty horrific, isn't it? So. Are you for it or against it?
So I think there's some real challenges for us around around things like data protection and how we use it. So I think where in my experience where we've had things that have been sent, it's very difficult for us to use in terms of evidence and that sort of thing. In terms, what we could actually do with it in terms of enforcement. However,
if I had my mum using your test in Burgess Park, what is it all right for me to, basically film her care? Do you see what I mean? I'm just trying to figure out, because obviously might not be able to use it, but what are you saying to other people?
Well, what we will use is the concerns that people raise. So where we get any kinds of information that comes through that's confidential, and so we do get films, and we are quite careful about how and who watches them, because sometimes it's but we watch them, but we have to be very careful around dignity. So if it's somebody female, we would make sure it's a female inspector that would watch the video, and it's very limited and things like that. But we will use that information to inform our inspection and whether we, and it's about it feeds into our risk process really. So if we see information that we believe is people at risk, then we will use that information, and we will very carefully look at that and find evidence that we can use on an inspection.
Thank you. I meant to say panorama, not YouTube. Personal meltdown. Sorry, just for the record.
But I know there's some information that we've publicised recently, which I can send a link to or something afterwards, which very specifically gives our approach. So the examples I've given you are kind of practical examples about how we deal with information when we get it.
That'd be useful. Thank you.
Did you have some home care questions?
Yes, I did. I think you've tapped on it a little bit. Talking to people, I mean, the work that you've done, the lay observation looks amazing, really, and the fact that people are like really surprised that you're talking to them. I'm just wondering if you had any ideas for building that into, our processes. Any tips for that? And are you talking to families? Because that's the thing that strikes me, when we spoke, with the team over there. Who's talking to families? And at the risk of being like a cracked record, but at least I'm being filmed now. The council pay for this thing called patient opinion, care opinion, and that allows people, either people being cared for or their families, to say something about the care that they've experienced. But it also, it sends, basically it alerts the care home that there's something on the World Wide Web that they may want to come back on. So, basically, are you looking at IT, are you talking to the families as well? Not that you're not doing enough, but I'm just wanting to get as many tips as possible, really, on how we can go forward with this.
In terms of talking to family members, yes, where we can. Sometimes family members are even, how shall I say, the main contacts. There are normally we would talk to the service user. Very often family members are there themselves. Sometimes the meeting is conducted really with the family member because of, for instance, advanced dementia. We try and involve family where we can, even to the extent that we would conduct the interview later on in the day when people finish work. I have to say that whilst I do this job, I also wear another hat. My mother lives in Southwark and receives home care. So I suppose it gives me a bit more of an awareness of the issues, and I'm definitely coming from that. Is it good enough for my mother?
Joe, on that thing then, have you had an example, and you don't have to mention any names, but where you've spoken to someone and you've had to alert someone, and what has been the process, really?
What has been the process? Well,
if you've had an issue to deal with and you think this isn't right, and you report it, and what, how's it been resolved?
I mean, in terms of this project, right, it's funded for 2 days a week. I suppose the greatest part of the project is gathering the opinions of people and identifying trends. But there are times when something isn't right. Yeah. So then we would get involved with either the social worker, or it might get referred to our SAIL project within Age UK, so that another member of staff can follow that up. Because with my 2 days a week, following up with social workers sometimes can take as much time or more time than actually conducting the interviews.
And does it work? Does the process work?
Well, not straight away like that. Often, whether it's in a care home or home care, if an issue is highlighted, it takes a long time to resolve it. It isn't something that's just resolved like that.
Is there a certain point in that process where it's always, which is the bit that always gets stuck, or is it just all the way through the process it takes a long time to get through?
There isn't one bit
No.
that causes it. It's just it takes time to implement those changes. There's
What I hear, not just from Joan, but from other people that work in our organisation, is that a major problem is a lack of accountability amongst people. And so the more people that are involved, the less likely there is to be a resolution. Because everybody knows a little bit of the problem, but nobody wants to take over all responsibility. And I think that's why often things that are really simple take a very long time to get resolved. And where we find that we're able to actually talk to everybody involved and go, oh, well, actually, this is what's going on, and come to a really, really easy solution for somebody that if it's left within the statutory sector
And
can take
do you have any ideas about who you think should be that person that ultimately holds the accountability?
well, what I would like, not in terms of the person that ultimately holds that responsibility, but I would like to have, when an issue is identified, I would like to have a department or a named person within the council that I go to straight away, not different social workers.
Yeah.
That's what I'd like.
Yeah. And then it's the link with health
Yeah.
and getting health and social workers.
And I know that in terms of what went on not that long ago, in terms of trying to report an issue of poor practice or something, whoever was dealing with it beforehand wasn't dealing with it very well.
If can I just say that? So the thing about this person who is accountable and a known person, that only works, doesn't it, for half the service? Because if you've got someone that's in hospital and they keep getting bounced out of hospital, but then they find themselves there again, then there is no point having someone at the council to be that person. It would have to be someone in the hospital, wouldn't it? Do you see what I mean?
But I'm saying that it would be easier. It would be easier for this project to have, rather than going through to different people, like somebody who just deals with issues to do with quality.
Yeah. Okay. Wonderful. Thank you. Maria, did you have a...
Yes, there's actually one question and one comment. The question is, how would you actually determine the level of dehydration in a person when you go to visit a care home? What would you do as a test?
We would be looking at information, so we would look at information from...
So it will be charts, really.
So it could be charts, it could be the person themselves. What we'd normally do, particularly when we find a problem, we'll look at lots of information and link it all together. So we would look at charts, but we wouldn't just look at charts. We'd talk to people, we'd talk to their relatives, we'd talk to healthcare professionals who might be involved with a particular person, who might know the person. We'd talk to staff about what they were doing. We talk to the manager, and we might ask questions of the manager about things that had been raised through the things that we'd look at. We'd look at the records. So if we pick up that there's an issue, and I mean, we had an issue obviously at Tower Bridge, we will look across and everything in quite a lot of depth to get the full picture of what that is, but also to gather the evidence that we need where we might be taking enforcement action.
Because it's very easy, for example, if you send somebody who has medical training to know the level of dehydration, because when you pull the skin and if the skin doesn't react, then you know that it's very easy. You don't need to look at charts. You just know immediately that the person is little dehydrated, extremely dehydrated, and you know, for example, you comment that somebody was very aggressive. One of the reasons for being aggressive is either dementia or is dehydration. Lots of people suffering from dehydration are very, very aggressive because they suffer headaches, they fall over, and they are violent. So that was my question.
Yeah, and the other thing that we have, as I sort of mentioned before, we also take a team on our inspection. So it's not just one inspector, we will take a team. So we might have a nurse on the team.
That's it.
And that's the thing. But we will
has medical training.
Yeah, and so that we do sometimes when we have professionals on the team, they will pick up things that other members of the team might not. But we will, where we identify a problem, it's really important that we speak to other people and other professionals that are involved in that individual, because they know the person, because, you know, I think that's what's very critical as well. So,
Thank you. There's just a comment that I mentioned. Congratulations about the job that you are doing. I think it's fantastic. But one of the things that you mentioned is that the carers, continuity of carers is very important. And I have seen time and time again, especially with people suffering from dementia, that if they don't have continuity of carers, they go to pieces. So I think that is one of the most important things that we can implement, is continuity of carers if we can. So that was my comment.
Can I just make another comment, not in response to your comment, but something you asked that I didn't address actually. You talked about, you know, any handy hints, how can we move forward? I think, you know, if we started off from the beginning again, I would like to see us working much more closely with the council, finding out what the council wants us to, you know, to look at in particular, and also to be looking at particular providers. You know, not just doing this big overall thing, but going in and saying, right, okay, we're going to look at provider X this month, provider Y this month, and also that the providers know we're going to be doing that, because I think, you know, there's this attitude like, well, who's going to check?
Yeah.
Bill,
Yeah, it's just sort of a follow-up on Maria's comments. The inspection team, it's never one inspector, it's a team of. And you said sometimes there's a healthcare professional, GP or a nurse. Sometimes, why not always?
it depends on the service.
Right.
So for a big nursing home, we quite often would take a healthcare professional on the team. So we have like we call them specialist advisors, and they might have different specialisms. But if we were going to a very small learning disability service with you know 6 people in it, it might not be appropriate to bring a team of 8 people.
Sure, you wouldn't have a team of 8, but you would have a healthcare professional, would you not? Even if it was only a team of 2, to look out for the
No, so our priority is always actually to bring an expert by experience.
Right, okay.
So that's the priority. So we've got somebody, but we may not, or we try to sort of have a team that's appropriate to the service when we're sort of planning the inspection. Okay. But what we sometimes do as well, and we've done like a couple of examples we've done recently, is if on our first visit we find particular issues that we feel we need to bring somebody or a particular specialist advisor in, or a pharmacy inspector, because we've uncovered something that suggests that we need that, we will also do that. So it's sort of, hopefully it's something we've planned for, but if it isn't, we have the ability to be reasonably flexible. It's sometimes very difficult to get the resources, but we do it.
But don't just rely on charts, because I think
Thank you.
It's
give you the full picture.
Yeah, I think one of the most important things for us on our inspections is what people tell us. I think that's often and it's what staff tell us. And when we sit down and talk to people,
Relatives much more than staff, I think.
Yeah, but staff sometimes tell us things that they don't maybe flag to their manager. So they do. You know, we do find sometimes we get information, and staff say something that then makes us look at other things as a result. So it's
a bigger picture.
Yeah.
David, did you have another question?
It's to do with the home care service. So I think you said, did you say you've been set up for 8 months, or you're going to run for 8 months?
No, I didn't say anything. But I said it's going to be running for some months more, for several months more.
How long does your funding?
We have 6 more months funding at this point.
And you've been running for how long already, roughly?
The project's been running for over 2 years, but I've been doing it for just over a year.
Okay. And remind me, how is the lay inspector? How is that on the care homes? How is that
funded? That's funded through Southwark.
Okay.
Yeah.
So I guess my question would be, if your funding comes to an end in 6 months, whether there's going to be any sort of possibility of Southwark funding, something, a continuation, because it sounds like it would be very sad to lose that independent assessment, I think, of home care. Because I mean, in some ways, I feel people at home with home care are arguably just as vulnerable as people in home care to poor service, and there's perhaps less other people to see what's going on in a sense. So I appreciate that we can't put Stephanie on the spot now, but it would be nice to think that there would be some sort of ability to maintain that service, and possibly to try out those different sort of models that you're suggesting about looking at specific providers and things like that. I mean, I suppose my only other question is, do you think people who are receiving bad or not adequate home care, do you think they feel confident about making a complaint, or do you think they feel they can make a complaint?
I think most people are able to make a complaint, certainly an informal complaint over the telephone to the provider themselves. Usually it's resolved. It might take a wee bit of time. Most people feel able to do that for themselves, but there are some who are absolutely unable to do that for themselves and who don't have anybody to make that phone call for them.
Well, that's where essentially what you're doing is so important.
Okay, wonderful. Unless anyone else has got any questions. Thank you very much. Oh, Tom.
I just wonder, we really need help on this. One of because we're not medically trained, we have a problem that we're not allowed to look at the drink charts.
Okay.
Now, we know, for instance, anybody that goes from a care home into a hospital, 9 times out of 10, the first thing that they say is they're dehydrated. I think that surely we can find a way that the lay inspectors can surely, I mean, we're not talking about, that's a simple thing, but at the moment we're not able to. I think we should be able to look at a drink chart to know that that person, and what you're talking about, you're not talking about with older people with dementia. It doesn't take a lot for them to go dehydrated. We're not saying. So how do we? Is there a way? Can you help us on this?
Who prohibits you from looking at them at the moment?
I'm asking the really.
Is it the council?
I'm
Okay.
thinking. Well, I don't know. I'm wondering if Helen can.
I don't know if it's just worth.
For us, it's an issue of the privacy. Actually, looking at your charts and your records is a privacy issue, and I think we will do check that kind of stuff. So it's already checked by monitoring, it's checked by CQC. We have lots of other ways of checking that kind of stuff, and I think around residents' privacy, it's not a training issue.
It's a privacy issue. Okay, so Helen, did you have anything but no? Okay, wonderful. Well, thank you very much for coming. That was really useful. I wonder amongst us if we just think about some initial recommendations. Jasmine, you had a couple. I think there'll probably be a few that come out of this from the first session as well, which would give me a hand at least in putting together the beginning of a report. So I think there's probably something around ethical care journey part 2. I don't know if you've got any words that you have written down or things that you want to factor into a recommendation at least.
I mean, I think the kind of core of the recommendation is that it should happen. Otherwise, what I'm concerned we'll end up doing is having lots of conversations that we say, well, these things are ongoing, but no end point or they'll lose a purpose, really.
There needs to be milestones then attached to
Yeah, exactly. And I think that I mean what's contained within that, what we've heard all the way through, including from the presentation we've just heard, is about the voice of staff being able to be heard. So I mean I think sort of trades union involvement, trades union recognition, in formulating that and as part of that as other charters.
And Julie and I were talking about so when we looked into Southern Cross in 2011, the GMB put in a paper to this committee. At the next meeting, we're going to try and get GMB and Unison as well probably to come along, so we can talk a bit more about the trade unions, kind of when we have a bit of a round table and get them to feed in some thoughts then as well.
GMB were very had flagged up concerns about staff conditions at care homes.
So that's kind of.
Yes, I think that it will be important to have a diary of events. So that means we have all the recommendations, whatever happens now, what is going to happen, what recommendations, what are the things we have implemented, so that at a glance we can have a look, oh yes, in such and such a date, this happened and this recommendation was made, this was said. So, you can look back.
Yes, that's fine. I think there's one bill, something about staff training.
Yeah, so it's around continuous professional development. And again, KPIs attached to that with the providers and the contractors. How do they, it's around training, how do they train, what do they train in, how is that training evaluated, how are the trainers evaluated, and the progression, the career path progression within that, within each provider.
Okay. David, I think there's probably something about funding that we can put in, we can easily put in that the council needs to consider funding home care and care homes.
Yeah, no, I mean, yeah, it'd be a shame if it came to an end.
Exactly.
I don't know how much the other sort of home care lay inspector scheme costs, but I'm assuming it's not a lot of money.
No, I think it's worth putting it in. We can refer up to Steph at least to and then I think there's probably one around kind of having a named council contact for complaints re home care.
Yeah,
James,
I've got that on my list as well.
And probably something around working more closely with the council and joining up what Age Concern are doing.
Yeah, there was another one on the end, that the drinks chart.
Yeah.
The drinks chart can be separated from the drugs chart. It doesn't infringe anybody's privacy, and data protection is then not involved.
Okay.
It's a simple drinks chart, it's not the drugs chart.
I'm not sure if that's correct, because the hospitals had to prescribe it, didn't they? And so we'd have to look into that.
I think it's probably to be considered, because it seems odd to not let people look at bits of information like that. It depends what the levels of data.
Especially since it's such a crucial factor.
Yeah. Especially as the notes are in a tray at the end of the bed.
Yes, exactly.
Hello. Hardly data protection there.
Okay. Jasmine, did you have a couple more you wanted to throw in as well?
Client, under the general heading of client-centred, active working with relatives, encourage relatives to meet one another, because I think that's something that did not come across in any of that. And you see, what could be simpler than if you were going on holiday, to say, look, I'm going on holiday, keep an eye on my mum, as what's been used here, or Andrew Sutcliffe's mum. 2, publicise all methods of, you'll have to do something in this, of user engagement, including the use of patient's opinion and care opinion, because we are actually paying for that. And named person, you've already, we've done that. Campaign on safeguarding vulnerable people and publicise all of the above, basically, including all Paul's and Bill's and sorry, I've forgotten your name. Maria and David's books.
Okay, and so I think that's a helpful start, and I will feed those in and then obviously circulate them for comments. I think so for the next meeting, what we're planning to do is trying to get the home care providers along so they can talk specifically about the care homes in Southwark.
That'll be fun.
Exactly. And then have
we're going to get them, these ones.
Yeah. We're going to try.
I think they're actually required to come.
Yeah, I think if we ask you that. There you
go. The parents' scrutiny.
So we'll probably do that bit as a more formal bit like this, and then we'll have a more general thing and try and get some staff, some residents, try and potentially use patient opinion, care opinion, get access to Health Watch to some of the unions, and just try and get some people who interact with care homes and home care to come and talk to us about their thoughts, so we can put in some kind of user-specific recommendations as well.
I mean, it might be worth just looking at the stuff, Joan's points again. I mean, I wrote some of them down. So, once you've done that draft, I'll have a look, see what else she said. But also, at least we've got the footage as well, because she was just fantastic, wasn't she? Thank you.
Wonderful. So I think that concludes that item. Unless there's anything else? No?